All right, thank you, Selene. Hello, good evening, everyone. My name is Anny Hsu. I have prepared a couple quick slides to talk about women in orthopedics, which I will start and share with you. And then we will continue with our esteemed colleagues here on the panel with me today. And we will, give me 1 second to share. All right, so today we'll be starting off talking about women in orthopedics overcoming inequalities and challenges. And this is quite an important topic. In fact, the most recent Journal of American Academy of Orthopedic Surgeons put their cover on this particular article looking at the current state of diversity in orthopedic surgery residency and future direction. And I think we've come a long way for women in orthopedics, always being known in the past as a minority group. So now there's up to 15% of the residents in the United States are women, and that adds up to about 6% of the practicing orthopedic surgeons in the US. And although this number is continuously increasing, we are not increasing as quickly as some of our other surgical partners. So comparing to general surgery programs, there's about 26% of the general surgery programs have a female director, and in orthopedics, that's only about 9%, although that number is certainly increasing. And I think it's very important to point out that this, the low numbers that we're seeing, that gender by itself is not really associated with the lower odds of admission. But in fact, that sometimes in some scenarios, in this particular study, they showed that women are self-selecting to be out of orthopedics. And I think it's important to point out that this is probably tied in with some overall global challenges in gender inequalities, and that probably includes limited exposures at various stages and a very broad general cultural stereotype that young women and girls are exposed to early on. And then even as women continue to progress into various stages, they're likely limited support. And just as an example, female residents in the US comprise of up to 13% of the residents. But a higher percentage of women, unfortunately, leave orthopedics comparing to their male counterpart. So to overcome these gender inequalities, there are multiple programs and ongoing programs that are growing bigger and in size, and certainly reaching out to more and more groups, more and more different social circles. And they really focus on expanding longitudinal pathway programs, reaching out to high school students, college students, so that they're more exposed to engineering, to science, into orthopedics, and providing multiple mentorship programs at various levels of training. And lastly, I think there's a global awareness and increase of institutional support to help overcome gender inequalities. So with this very brief introduction, I'd like to introduce my panelists with me today. We, of the three panelists that you see here, unfortunately, Bonnie is unable to join us due to some flight troubles, but we do have Dr. Judy Baumhauer and Dr. Naomi Shields. So Judy is serving as a Vice Dean for Academic Affairs and Professor of Orthopedic Surgery at University of Rochester, very well known to our community and have served multiple leadership roles, past president of ABOS, AOFAS, EOA, and Promise Health Organization. And Dr. Naomi Shields, also very well known to our field as well, as she currently practices at True Ortho, which I'm impressed is an all-women orthopedic surgery group, and also served on the board for AOS, AOFAS, and past president of OEF. So with all of this information quickly going through, I want to kind of turn the mic over to Judy, and then we can start our discussion.
Great, thank you so much, Annie, and I'm delighted to be here with you and with Naomi, and want to thank Selene for having this be the kickoff. I do think it's a really important topic to discuss, and I'm going to just first share my screen. Hopefully you can see that. As Annie talked about, the gender gap is closing, but really quite slowly. So there was a great paper that looked at the prediction models of getting gender parity to the level of 36%. It would take 16 years. So although we're making headway, I'm hoping the slope increases. I've certainly seen change over the course of time, and we're going to have a little discussion about some of our changes that we've seen and some of the things that have worked and maybe some of the things that haven't. Exposure is really important. So if your medical students or even high school students don't get an opportunity to see a woman surgeon in action, they may in fact never think it's something that they could achieve, when we know that's not true. This particular slide hurts me because we see that those who are in academic practices, that the men far outgrow the women from a standpoint of being able to progress from assistant professor to associate professor, full professor. And I would argue that it may be that women don't know the rules to win the game, and we certainly could work on that. Exposure is very important, as I mentioned, and Annie mentioned a little bit about opportunities, including the Perry Initiative that I hope everyone is involved in, where we hit around 10th graders. All three of my daughters did the Perry Initiative. And then we get med students that are in year 1 or 2. Looking to your medical school for a MSK rotation. Now, it has been a big gain for us. Getting mentorship in high school or a medical school. There's a program in Vancouver, the academic program in Vancouver, where they try and attract individuals that are in medical school and even younger, and women in orthopedics. It's called the Worth program, and that's helped with the pipeline. Certainly engaging women in research early on, even if it's their simple survey studies or something, so that they feel engaged. And of course, the ninth dimension has made a real great impact for us as well. As Andy mentioned, retention is really important. So those academicians or community orthopedic surgeons that are women, we need to keep you in the workforce. And how do we do that? Well, we hopefully provide some mentorship during residency, so you feel as though you have someone to go to when you have challenges, and provide some leadership training, so you know how to negotiate well and lead once you get out in the community. In early practice, really important to have mentorship. Again, I put down leadership training. Even though we are unbelievably trained, skilled individuals from a standpoint of the orthopedic surgery that we do, we don't really get enough leadership training to allow us to understand how to approach things like negotiation, or things like understanding conflict. And it's also really important for networking, and we'll talk a little bit about that later. And the networking isn't just women with women, it's women with men, and being able to work together towards common goals, and working in groups, really important, building teams. You need to think outside the box. Sometimes your home life needs you, and you need to look for shared practice opportunities, and I'll talk about that in just a second. Where you might be able to interact with another individual who also wants to not be at 100% time, but still needs to have a fulfilled career. And then we also need to get parity with our pay, with the opportunities for growth, not just academic rank, but also through your institution and taking leadership roles and advancement. So a couple observations. The proportion of women among newly board certified orthopedic surgeons has increased, as we heard, up to 14 to 15%. And that, of course, is a positive trend. But despite this increase in board certification and numbers, the percentage of practicing female orthopedic surgeons remains low. And that suggests that there are potential barriers to practice continuity and continuation. And lastly, the disparity between the number of board certified women and those who are actively practicing may be influenced by factors such as the workplace culture and maybe some of these microaggressions and things that are challenging to deal with, that require some training to handle, the work-life balance challenges, and limited mentorship opportunities. I'm going to talk a tiny bit about some potential practice models that I've seen come up in my role as Vice Dean. I've had an opportunity to see a lot of different practice models, and certainly, although I'm in an academic practice, Naomi has had a couple practice models that are different, and she could share some of those. There's job sharing models, and we had in our orthopedic practice academically two male orthopedic surgeons that shared one position. And what they did was half their job was clinical and the other half was research, and they went into the lab. They were very successful in both aspects. So sharing structurally can be helpful. And of course, it helps to maintain a full patient coverage. It reduces your burnout and attrition and gives you some flexibility. You need flexibility is a key item, and scheduling models around the needs that you have are really important. One of my past fellows actually quit her position because she didn't have the flexibility to handle the things that she wanted to do, like put her son on the bus in the morning, even though she knew she could see the same number of patients in a different time capacity. But yet the flexibility of the system wouldn't allow her to do that. So we need to change those things. Telemedicine has allowed us some flexibility, and we recognize that COVID has been challenging, but it certainly opened up telemedicine and the acceptability of telemedicine. So you can use telemedicine in some capacity in orthopedics, not in all aspects, as we know. But my partners in sports medicine do some of their follow-ups through telemedicine. There are part-time opportunities in clinical tracks in academic medicine, and you would adjust your income around those things, that's for sure, but also it gives you time. So you got to think about what's important to you and how you want to manage that. And lastly, there are a lot of non-operative or other roles that you could take. You could be a practicing orthopedic surgeon and run an administrative job, like a medical directorship. One of my partners is the CIMO for our institution. There's a lot of industry roles that you could do part-time. So there's a lot of different opportunities and kind of fulfilling and interesting opportunities as well. We, of course, have to make good use of our physician extenders, and we've certainly tried to maximize that, but learning from others how they're utilizing that to be able to do team-based care models are really important. This allows us as surgeons to focus on the higher complexity cases and allow some of the follow-ups to be done by our physician extenders. I thought it would be kind of fun to talk a tiny bit about building teams just in a big, broad sense, and then we can drill down in it when we discuss this. But first of all, on the left-hand side, you can see the need. And on the right-hand side, I thought it would be fun to show Selene's example. So Selene has done a great job building a team for today. So he has 24 hours of team members, which is really Excellent. So the initial component was he needed to find a shared purpose, and it was to unite the world around foot and ankle. Foot and ankle, or I would even argue orthopedics in general, around major topics. How did he do around fostering psychological safety? He put us all in it together. He put everyone who wanted to have participation could reach out to Selene and have some participation. What about aligning with individual strengths, an important need in building a team? Well, he said, pick your topic. He picked his moderators, and the moderators picked their members and allowed you to pick your topic. So it allowed you to align with your individual strength. And then standardized communication. How did he do with that? Well, he set us all up on WhatsApp and sent out emails. There happened to be many of them, but it certainly helped us align ourselves. Did he create team rituals? You bet he did. This morning, he started on the WhatsApp saying, we're starting today. And before you knew it, you had welcomes from around the world on WhatsApp. He created a team ritual. He set expectations and accountability. He gave you emails telling you the date, time, and check-in connections. He empowered mid-level leaders, individuals that range from early in practice to late career to retired from practice. So a full range of experience of faculty and leaders. And lastly, he will recognize and celebrate this win, because at the end of this, I am sure there's going to be a WhatsApp explosion of celebrating. So with that, I will turn it back over to Annie to start the discussion.
All right, thank you, Judy. So just to remind everyone, you can also, our attendees, you can type in questions on the group chat box if you have questions. So this is a pretty laid back session that I think feel free to jump in at any point. Naomi, I wanted to ask a question more, and have you kind of kick off, because I know that I mentioned briefly that your practice is quite unique. Your experience is very unique, and that you have practiced in the military before, as well as in private practice. Would you like to contribute and kind of share some of your experience with looking at, gender inequality challenges, and maybe also some progress in your particular arena?
Absolutely. I actually went into orthopedics before Judy's 3.3%. I was in medical school. I didn't even know orthopedics existed until my third year, when I went to a 2-week rotation. And I grew up in a really small town, no physicians. I was going to be a family practice doc. And I got to the orthopedic rotation, and I went, wait a minute. I'm going home and I'm wanting to read about this. I'm liking the people I'm working with. I like the fact you can go to the ER and you can straighten out somebody's broken wrist and do it right then, rather than waiting to tell Mrs. Smith, come back in 6 months, take your medicine, get your blood pressure down, get your weight down. I like the see it, fix it approach. So I changed all my 4th year rotations that I could. And I applied for orthopedics, not once, not twice, but 3 times before I got in. And I will say to anybody who recognizes something that's their passion, it's important to do that. I did not meet another woman orthopedic surgeon until I was well into my private practice. I didn't even meet one in the military until I was in private practice. So I think times have changed a lot, that there's a lot more mentorship, there's a lot more programs. The AOFAS should be very proud of what they've done for women and helping include more women in the podiums, on the awards, on leadership positions, and finding ways to help us develop mentorship. When I did get into residency, there were 2 of us in my year who were single. The male went into the chairman, and he was told, this is the time to sow your oats. Go have a good time. You can settle down later. I went in and I was told, keep your pants zipped. They're going to be looking to get in your pants and discredit you. You can't do anything out of life. That was in 1985. I hope things have changed for that since then. And I I did a military residency. I was the first woman orthopedic surgery resident through there. Then I did time in the Air Force. I was orthopedic chair at one of the bases for several years. And then I went into private practice. And it was a totally different model than the military. And it was a good old boys network. And I started in private practice. I became very successful quickly as a foot and ankle because there was only one other in town. And yet, as I wanted to advance in leadership and roles, I had to go into the program chair multiple times. I wanted to go to the orthopedic residency course. And he kept saying, oh, I forgot you wanted to do that. And meanwhile, he put up some of my junior partners to go. And the same thing when I was trying to advance to associate professor and then to full professor, because we were a private practice affiliation with KU. And I finally got him to put it in by going in and saying, if you do not put me in this year, I will be going to the dean. And you can explain why for 6 years you have not put my information in to be applied. And once he put it in, I became a full professor affiliate, but at KU. So some of the things I learned was the only person who's going to really speak up for you is you. It would have been very helpful for me if I had some of the mentorship and leadership training that's available now today. And I would encourage anybody to seek that out. I was in practice for 24 years. And then for personal reasons, I moved to San Antonio in 2018. And am now in a group that's 4 women orthopedic surgeons. We think we may be the only one in the country. We have some different practice models within the group. 2 people are concierge. 2 of us still take Medicare, which leads to some different discussions. I've learned that some women can be as competitive as men when it comes to money. And, but I think we all have bigger hearts. Our patients universally say they're very happy to see women. And I think a lot of patients want to see women. So I think that if we can find ways to expose high school students more, and I fully participate in Perry Initiative and think all of these are great things, I think we will help change healthcare here. But I also think we need to be looking at the ability for women in other countries to get into orthopedics. I teach with the Egyptian Foot and Ankle Society course in November. And I was very impressed. A couple years ago, there was a woman orthopedic surgeon from Saudi. There was one from Ethiopia, one from Nicaragua. And I'm thinking, what did they go through to become orthopedic surgeons? And, I thought my journey was tough, but I think theirs was probably even tougher. So I encourage everybody, and it may be a little long-winded, Annie, but that's my story.
Oh no, that's great. That's great. I think I think we all went through different journeys, and I think it's great to share them to to our listeners as well, because I think despite there being many challenges, there are also always a lot to be learned from, and in line with what you were talking about with the international community, and hopefully at this hour we have other non-American listeners online. I went to the Orthopedic Foot and Ankle Society in Taiwan earlier last year, and during a course of 40 people, there were really very few female orthopedic surgeons. But I think it's great that from different countries, as we go over abroad and have exposure to work with and collaborate with other people, I think it's important for their younger students and also just their own, even the older orthopedic surgeons to recognize and support other women colleagues. I think that gaining recognition amongst men is one of a big step to kind of promote younger women from joining our field. I do have a question though, in terms of, I think, kind of going back to the talk of retaining women in orthopedics. What do you foresee as the biggest challenge? You have these wonderful, smart, brilliant young women going through training, which is very challenging. regardless of gender, and having to leave orthopedics after finishing the training. What do you think is the major limitation, and how can we help minimize that?
I think it's challenging when you come out of residency to go into practice. I don't think we train residents enough about those first steps to go into practice and the business aspect. I would love to see some business and leadership courses integrated into part of the orthopedic residency curriculum. I think that social media is going to make a big difference. I don't know, there is a closed Facebook page, Women of Orthopedics, and I think that has been invaluable for people to reach out from all over the world and ask questions ranging from how do I take care of my baby with this to I've got somebody giving me a hassle at work to look at me, I got promoted. And so it's a way that as a community we can support each other, because I worked by myself or with one partner as a woman partner for 24 years. So it gets lonely when you're there by yourself. And I love going to meetings because I met other people who were like me. So I think getting support groups, I agree totally with Judy. Your mentors cannot all be female. You want to get mentors. You want to build bridges. You want to build bridges with your communities and with your referring physicians. And I flat out now ask people, they come and say, oh, Dr. Shields, you're the best. I love what you did. I said, if you're really happy, would you leave me a Google review? Because people look on social media. They want to know who's got the 5 stars. They want to know who people like. And so by being able to build that as much as you can. I think the other thing that we need to do as women is stop sabotaging ourselves. We tend to say yes to a lot of requests that are kind of make work things to do. Oh, would you take notes of this meeting? Well, why me? Because I'm the only woman in the room? One of you guys can't pick up a pen or type on your computer? And to prioritize what you say yes to, that it fits with your values, your goals, your mission, and politely figure out a way to say no, which has been very hard for me. I think we have to believe that we're as good as the guys. And I know for a long time, and I still to some extent do because of the way I was raised, I would defer to them because they were a male. I've had to learn to believe in myself and believe I'm as good as they are. I think we need to support each other. Not women can be awful when they're catfighting, and they can chop each other off at the knees so fast. But we need to find ways to praise people in public and be negative to them in private so that we're supporting each other. We need to nominate people for awards, for recognition, for leadership positions. I got on the board of the academy because RJOS had a thing that said we need to nominate somebody. So I called up Laura Gehrig and I said, who are we going to nominate? She goes, well, I think you'd be a good fit. And I went, what? I never thought about it, but that was an amazing 2 years. And same thing being on the Foot Society board. And I just think we have to find ways to integrate, to collaborate. It's not just women against men. We have to make ourselves part of the system, part of the team. And then we need to expand what we're doing and work on the things that may be a little bit outside our control, like insurance reimbursement, payment. I'm a horrible negotiator. I don't know how to do it, but it's teaching people to do that. That's where Judy and everybody else can teach things. But that's what I think. I think we're growing. We're not growing fast enough when medical school is more than 50% women now, on average in the US.
Annie, how do you build a team?
I like to, well, so I have to say that I'm not very seasoned in terms of building teams. Usually I've been requested or asked to do certain things, but oftentimes kind of similar to what you were saying with the way Selene picked these sessions. I find that if you ask people what they like to do and have a passion for what they prefer doing, it is much easier as a person kind of overseeing them and building the team. So usually I try to find the things that people prefer to do and then build the team based on their strength. Because personally, I have a lot to learn in terms of leadership and, working in groups to make sure everyone collaborate well together. And I think that if your team players are already passionate about the role they play, then it makes the work a lot easier.
How about you, Judy?
Yep, I think, first of all, I think you have to have passion over the topic. So if you love it, and then your energy totally gets other people going. So you can even recruit the most difficult people to join you. And then during the time when things are successful, you really celebrate those successes hard, even if they're little tiny things, because it gives you an opportunity to recognize others in the hard work that people are doing. Because, startups for any projects are usually a little bit of grind until you get the thing going. So you have to encourage people to participate, recognize the project success, but also the individual's really great skills. Pivot. Things aren't working, pivot. Ask people for their opinions. Make sure everyone in the room is speaking up. All those things are really important. And, when you do that, you don't do it to look like a leader, but you become the leader because you're the person that starts to guide it. So it's really important. And I also think it makes it fun. It's why you don't leave, because you're doing projects you love and other people are there with you and you're all in the boat together. What makes you leave is when you're a solo, when you're all by yourself, you don't feel like you have any unity with anybody else. And those are the people we have to reach out to. Anybody who feels alone, because there's probably something they could join and we could keep them. We have to work on retention. We really do. That's probably the number one problem. If we're increasing the pipeline, but we're not increasing the workforce, that's a problem.
I think another thing for retention is finding ways for people to get work-life balance. Because I know for myself, when what was vital to me, where my inner wants or my inner moral ethics, I felt sometimes like I was constantly being beaten down and battling against the system. And when the system, and it's changing some now, but it used to be you give up everything, you don't sleep, you take care of your patients. I never married, not fully because of that, but a lot of it because of that. And I regret not having a family. And I think prioritizing your health, prioritizing what your desires are, and figuring out a way to stay in orthopedics and have that happen. So split schedules, like you were saying, maybe the job you're in isn't the right job. Maybe you need to find a different partner, you need to find a different practice. But there has to be a way for people to do that. Unfortunately, changing practice is so onerous in terms of licensure and credentialing and time and getting started again, particularly in a new community, is very difficult. And so finding a way to support people, finding a way to have people get their work, I'm going to call it work-life balance for lack of something else, but I think we need to work on that.
Yep, very important.
Go ahead, sorry.
I was just going to say, I think you really have to settle in on your passion. So, Naomi, I know that your passion is, helping others.
Voluntary?
Well, helping people around the world, all the humanitarian efforts you've made. And, maybe someone else's passion might be that they could do a locums job, right? So they could put, money on the table, but then go travel or go do the other thing that they want to do, the giving back that they want to do, or allow them some. So you have to start to explore models that are outside the norm. We can't just go like we've always done. You have to start to look for different things. And, I think what COVID also showed us was it's okay to deviate from what the standard was. So I think people are a little more open with that. Not all practices allow that, but That's what I wanted to say. What did you want to say, Annie?
Oh, I wanted to say that I think much of the focus also is to, to kind of encourage younger female students and residents from feeling comfortable and training them to stay in this field. But I also think that, it's a good thing as we train our younger like male residents that to them we're normalizing what it is to work with women and to treat them in a more equal sense. So it's kind of breaking the old stereotypes. I've certainly had many residents that told me that they enjoy working with female attendings, sometimes arguably more than male attendings, and I think that changes from generation as a big change and shift into the underlying tone, because we want to have male colleagues that we enjoy working with and can collaborate with, so that it's not just all the women in the society embracing each other, but also making the gender inequality not so much of an issue, hopefully in the future. And I wanted to ask also for mid-career, I think a lot of the focus is on early career, early, exposure in high school, in a residency. But what about mid-career and toward the end of career? Do you guys foresee any ways to support and promote female orthopedic surgeon in that stage of their life?
I think the Foot Society's been doing a good job to really help both the early career, but particularly the mid-career. By getting more women on the podium, more women involved with the educational aspect. I know Dr. Scranton was amazed in the first early days of the Vietnam Project that the majority of people volunteering were women. He was shocked. But we still went. We still had a good time. And we showed the Vietnamese that Dr. Thomas and I went together, and he wasn't sure we should send two women together or send a woman with a man. I said, what message are we sending if we say a woman has to go with a man? So Ruth and I went the second year and had a great time and showed the guys that women could do things. So I think if somebody's goal is to move up academically, creating and giving support for them to be able to do that. If somebody's goal is to grow their practice, to build a larger practice, to grow a position within their hospital, to become CEO, whatever, there should be business tracks and community tracks that they could be hooked up with.
Yeah, I think it falls down to what is it that you love? Where's your passion? And what makes you a differentiator? So, I keep going, and Naomi's, humanitarian efforts have really made her a differentiator in that area. People look at her and say, oh, she's the one who travels all the time and gives back surgically and educationally. And, I like to think my differentiation, I think, was research. So I did a lot of research to be a differentiator, and I loved it. I loved it. So you figure
I
out.
would have hated it, but she loves it.
I loved it. You have to think about what it is that you love, and then figure out, how you might obtain it. And he'd say, well, how do you figure out how you ask somebody? You ask somebody who does it well, and if you ask somebody who does it well and they don't really engage with you, well, then you ask somebody else. I mean, it's a cocktail party. You have to walk around and meet a bunch of people, and you got to figure out who you click with and who you don't. And then you also have to build your team around, whether it's humanitarian efforts or it's around research efforts. You got to build a team, and then you got to take that team to the heights that are going to be exciting. So you all are celebrating together. It's those kinds of builds that are going to be important. And it's going to include women, because women are good at that. They are actually great at building teams, and men. So I would just say that people have to think, strategically around how they are going to, grow whether it's growing in leadership, research, education, humanitarian efforts, teaching, whatever, curriculum, whatever it may be. It's all exciting. And if it's exciting to you, you'll make it exciting to others.
All right. So go ahead.
I also think if you started something and find this is not something I like doing, as Judy said, pivot. But I also think if you say you're going to do something, you do it. You carry through. Don't become known as somebody who's a non-finisher, a quitter, that sort of thing. Because that, if you do what you say you're going to do, you do it on time, you build your reputation, you attract success, attracts success. And the more you do, the more you're involved with, the more exposure you have, the more likely you are to meet somebody who says, you would be really good at this, or I have an opportunity. And when the I have an opportunity comes and knocks at your door, you have a choice. You step through that door. It may be totally uncomfortable, or you shut the door and you stay where you are. I say, open the door, walk through it.
Yep.
Awesome. I just wanted to also tie before we conclude. I wanted to bring in a new point. I think Naomi, you kind of touched upon social media earlier when you mentioned that social media is very powerful because when there are parts of this country and also around the world that perhaps we have other women interested in orthopedics, interested in medicine that do not have enough support overall. And how do you think we can use social media to reach kind of beyond our normal society, our normal residency program or local community?
You're probably the generation that could answer that question better.
Yeah.
I do think that there are so many different platforms on social media that there are teaching opportunities. There's a lot of garbage out there, and people Google Dr. Google and go on YouTube and watch stuff. But there are a lot of good sites. I think the Foot Society, the Academy with their different information sites, I think the societies, and I think YouTube has a lot of good, well-made videos, and a lot of companies, including this one, will use that as a platform for education. I think finding ways on social media to connect, for example, the Women in Orthopedics on Facebook, and there's probably others I have no idea about. And I think within your residency programs or your academic programs, you probably have social media chains. You have ways of promoting yourself. You have ways of talking about events. I'm not as good at it as I would like to be. I think it's a wave of the future, and particularly with AI coming, I don't even know where this is going to go.
Yeah. Annie, did you have something special that you thought social media was providing?
Well, I think, I see everyone, when I take the subway to work, and almost everybody on the train in New York is on their phone. Nobody's looking up, and everybody is either looking at some TikTok, Instagram, and I think that in terms of reaching out to people who don't have a mentor in their community, I think it's important to have a presence to show people, even if it's daily things, kind of like what we were talking about, how to balance having a kid and going to work and splitting the career into not a traditional, model. I think those are things that seems somewhat like mundane, perhaps to a certain community, but a brand new idea to others. And I like to think that I am great with social media, but I certainly am not. I think, the younger generation, the better they are with these videos. But I think because with experience, there's always a lot of, interesting stories to share. And I think it shouldn't just be an age thing. I really encourage everybody to try to put something on social media, whether that's like a podcast or a video or a clip. I know AOFAS does a lot of these podcasts. It's great because people listen to them. But I think that's another way to reach out to a broader audience.
I'll turn this around a little tiny bit. I see the social media of like the platforms to give talks and do those sorts of things as opportunities for individuals to get their points across, where they might not have gotten a spot on the podium or a spot here, and be able to push those things out perhaps and get some feedback on how people are feeling about it, because people don't hesitate to respond on social media. Whereas, you might go to a meeting and no one would get up to the microphone. It's kind of uncomfortable. But I would say that there is nothing better than sitting down in person with a mentor and talking. So we do it for convenience. We talk on the phone, we do, Zooms, and we do all these things. But there's nothing better and more engaging than having someone talk to you in person. And you saw just here, I stepped on Annie a couple times. I stepped on Naomi a couple times, because you can't figure out the cut. And yet in person, it's so much more fluid and it seems so much more engaging. So making sure that you when you have an opportunity to speak with your mentor or engage with people as a leader or developing teams, that you do touch in person as well as other avenues, other media. I just want to put that out there.
I'd also like to say that the perception for years was that orthopedic surgeons were all 6 foot plus brawny men who were strong as an ox and dumb as an ox. And I think where social media can make a huge difference is show difference that we are all orthopedic foot and ankle surgeons or orthopedic surgeons. And I'm 4'11". My new total hip partner is like 4'11". She's the littlest thing in the world, and she dislocates hips. But that we're different ages, we're different races, we're different sizes, and we can do it. And I think that helps to dispel maybe some of the concerns people have. Oh, I'm not strong enough to do orthopedics. And I think teaching how to use intelligence and keep it simple, work simple, not harder, or work smarter, not harder, is something that social media can help with in terms of the perception of what an orthopedic surgeon needs to be.
Yeah, I would also add in, and I've seen this at my own institution, sadly enough, is that the advisory deans, when people come saying, I'm thinking about orthopedic surgery, and they go, that doesn't seem like a great fit for you. And I'm thinking to myself, who are they? Like, are they putting the cap on them? Like, whatever it is, whatever that book series is. It's how do they know who these people are exactly, and how are they going to get in? They say you're not big enough, you're not strong enough, your mentality is not like an orthopedic surgeon. We're all different. We're all different. Yep, it's breaking those. You said that earlier, Annie. Breaking some of those preconceptions.
All right, absolutely. So I know we don't have much time left, so I wanted to, I know we have discussed a lot about women in orthopedics and pointed out that most of patients, more than 50% of patients are women. Women like to be treated by women, and we are working together as a community to foster it and increase retention in our field as well. So any kind of lasting pearls and things you want to end on to kind of help and support each other in this community?
I'll jump out there and say, Naomi said it to some extent. She said, take the initiative. If you have questions or you want something or you want to do something, if you don't ask to do it or ask for involvement or reach out to someone to say, hey, can I have a conversation with you? Then you're kind of wasting a little bit of time. If you know you want it, you should go get it. And women, I'm not making generalizations, because I don't know that all women aren't assertive in a positive way, but some hesitate. And I would say, just go for it. It won't hurt you. if you get turned down, so be it. Go pivot, try again. So that's what would be my word of advice in that. And second of all, we got to think ahead. We can't be looking back at what happened in the past
Right.
through some of the challenges we had, but we're thinking forward. We're thinking about how we're going to fill the pipeline and how we're going to retain the really great surgeons that are coming out of our residencies and getting board certified.
As I said, I applied 3 different years for orthopedics because I knew it was what I wanted to do. And I just had to finally convince some people that I could do it and that I would do it. And I am very glad that I got chosen many years ago.
And I think kind of in line with the assertiveness, I think my recommendation also, I think everyone is touching on similar things, is that playing into your strength and what you feel passionate about, because I think that really makes it easy because you don't even intend to, and you'll really shine in that arena, and don't let people, tell you what it should be or shouldn't be, because if you just push hard through it and follow what you really care about, I think there are, and show other people around you, whether that's people older than you or younger than you, sometimes you find yourself a mentor by reaching out and demonstrate that, or also to gain other people's support and younger people to look up for advices as well. I think it's never too young to be a mentor to someone who is in a more junior state than you, but it's also never too old to have yet another mentor in the field. All right, I think we are probably coming up on our Selene. Do we go all the way to 9 or do we continue? Or maybe not, we can continue.
I think we have about 3 more minutes. So I would just say for any women on this that are listening to this and want to reach out, feel free to. Mm-hmm. And I won't limit it. Any guys that need some advice. I've cracked the code on a few things, and I'd be happy to mentor anyone. So reach out. Easy to find all of our emails. Piece of cake.
Yep.
Well, thank you again for taking the time to speak to everyone. I think this is a very important topic, and oftentimes, sometimes a topic that seems like it's been discussed in a fair amount, but oftentimes not necessarily in a positive light. I think we were focusing a lot on the new changes, and I'm very hopeful. I think I've heard a lot of horror stories about people older than me, and I feel like the experience that I myself have gone through, I'm 5 years into practice, have been overall rather positive. There are certainly challenges, but I like to think that the more we pitch into this area, the easier it becomes for the generations to come.
Yep, I really appreciate the positive spin of this, and what are some solutions to some of the challenges, and I think that made it a great interactive panel. I really appreciate it. Thank you, Annie.
Thank you, Annie. I'm honored to have been part of it.
All right. There is a group chat box on the side. I don't really see any questions, unfortunately, but feel free to reach out to us afterwards. I think we're all more than happy to answer them, even offline as well.
And I would like to add, for any of the international attendees, and I know I say Facebook, so I'm dating myself, but the Women in Orthopedics is an international Facebook page. If you can access Facebook, and it's a great place to ask questions, to get information, to make contacts. And I would encourage you to find out in your communities, your countries, your regions, who's out there as well. And foot and ankle, sadly, is not in a lot of countries because trauma overwhelms everything, but it is a tremendous subspecialty to get into, and I would highly encourage it.
Yep. There might not be many women with you wherever you are in your country, but we're here. Reach out. We'd love to talk with you.
And I know that this is recorded, so there will be more people hopefully watching this afterwards. So, our information could be found pretty easily, I believe, from the website. Feel free to reach out to us that way as well. All right.
I think that we are up on our time, so we'll say goodbye and good luck to the next speakers.
Thank you, everybody.
Good night. Thank you.
Night. Bye.